For your health coverage this evening, getting an appointment with a doctor can be a waiting game, especially if you're trying to see a specialist.
Experts say wait times are getting worse at the expense of our health. After hearing that a lot from viewers, investigative reporter Paul Van Osdol looked into the problem. He's live tonight in Monroeville with what he was able to find. Paul.
Well, Andrew, studies show wait times have gotten worse since the pandemic, and experts tell me they see no signs of that changing anytime soon. We spoke to some patients who had to wait months to see a specialist, even when they had a cancer diagnosis. Seeing a medical specialist can take months, and that means more pain and suffering for patients.
I have foot pain and nerve damage. And to not be able to see someone immediately is a big problem.
I would like to get in as soon as possible and find resolution to the pain.
Almost a year to see a specialist.
Yes.
What was going through your mind while you were waiting to see this person?
I'm going to die.
Marlene Thompson had that lengthy wait even with a cancer diagnosis. You must be pretty worried about that.
I am, but what can I do?
For at least 8 or 9 years, wait times have been getting longer for specialty care.
Healthcare industry consultant Ken Siegel says the population is getting older and the number of doctors and nurses is shrinking.
Our demand for specialty care is going up faster than supply, and there is great instability in the system right now.
A 2022 study found the average specialist wait time nationally was 26 days. Action News Investigates asked Pittsburgh's two major health systems, UPMC and Allegheny Health Network, to provide their specialist wait times. Both refused. A statement from UPMC says in part, nationwide there has been an influx of people seeking to catch up on specialty care they may have delayed during the pandemic, and most U.S. health systems are facing challenges accommodating demand. The chief medical officer at AHN says the combined average for specialists and primary care is 19 days. Wait times vary depending on the specialty and the location. Are we talking in some cases 30 days, 40 days, 60 days?
Again, it depends. It's very much dependent on if you want to see one particular doctor in one particular location, because that can sometimes be a little bit longer wait.
He says people with more serious conditions can get in faster.
We have escalation policies for people, for example, somebody who has maybe a positive mammogram, to get them in quickly.
He and Siegel say wait times tend to be longest for dermatology, rheumatology, cardiology, and ophthalmology. Both health systems say they are working to lower wait times. Siegel says it can be done.
We've had the privilege to support in public health systems and others going from 6 months of wait time for specialty tests to 3 days.
A month apart is not too bad, and even 2 months could be all right. But when you're doing 5-6 months, that's not good.
Experts say there are a couple things that patients can do to cut down on wait times. First, have your primary care doctor go to bat for you. And secondly, speak up, be persistent, and keep pushing the specialist to get you in sooner. Reporting live in Monroeville, Paul Van Osdol, Pittsburgh's Action News 4.